Recording in progress.
Hi, how are you?
Hi.
Hi.
I'm good. I'm good. Thank you.
We're going to start the meeting in about 5 minutes.
Sure. Thank you so much. How are you? Good?
I'm good. Are you able to type your name into the chat so we can put it in the record?
Sure. Yeah.
Okay,
One
awesome.
1 second. Huh?
No worries. Thank you very much. And then I'll have you
Yeah.
just mute yourself until we're ready to go because we have a bunch of other things to do first.
Sure. Not a problem. Not a problem.
Awesome.
Can you do me a favor? I'm gonna ask my friend how to do that because I'm not.
You know what?
I'm
That's
not
fine.
good with.
Just spell your name right now.
It's Anand,
Yeah.
right?
Anand. Yeah. A as an apple. N as in Nancy. A as an apple again. N as in Nancy again. D as in David.
Perfect.
Thanks, Anand.
You're welcome. Thank you, guys.
Laurel, Anand's Town News.
You're right.
I'm not the chair. I'm just bossy. Cindy, are you the
The host?
Mhm.
I can be.
Hi, how are you?
Oh, here comes Candace. So let me see what she wants to do.
Sure.
Anand, you can just mute yourself.
Sure.
Thank
Yeah.
you. Mahuba, are you on?
Yes, I'm on.
Okay, Mahuba,
Yeah.
you can mute. Mahuba is from Carousel Variety. Do you want to just mute yourself?
Yeah.
Okay, thanks. Hi, Candace.
Hey guys,
Candace, you gonna claim host?
on it.
Got it. Thank you. We're just waiting for Maureen and Anthony.
2 minutes.
She can't open the meeting link.
Mine was quite delayed, so it may be like I started to get out and go back in and then it popped up, so I don't know.
Hi everyone, can you guys hear me?
Hey
Yep.
Anthony,
Hey, how's it going?
super, how are you?
Good. I'm on time today.
Well
One 1 minute to spare.
Yeah, do you want to take a lap or something?
No, gotta cut it a little bit closer next time.
Maureen's trying to open the link. I just resent it to her again. But we can probably start.
Oh,
Need
okay.
Elaine, right?
Yeah, we can wait like maybe a minute or two. I
Okay.
think Elaine might be jumping on. So
Oh, yeah.
unless she's not coming tonight.
Was that supposed to happen? Was Elaine not possibly able to come or?
There she is.
Oh, never mind.
It's the first time I've been on before her.
Hey, Elaine.
Hi, how are you?
Good, how are you?
Good.
I like those headphones.
You like those?
Yeah.
Nana's landing planes. How you doing, Elaine?
Good, thanks.
You sound congested.
Just my throat's a little dry. That's all. Just,
All right.
I haven't had any real fresh air now for a week, so,
Oh, I'll have to come by and make sure you open your door.
yeah.
So here we are.
Thank you, Erin, for your help in that problem, for that permit. I appreciate that today.
All right, we'll just wait till 6 and then we'll call it at 6.
Oh, my Apple Watch the 602.
I have 6:01.
All right, well, so let's call this meeting to order. It's
All right.
6:00 something on Wednesday, March 15th. This is the Board of Health meeting. We'll call it to order. President Candace Linehan, Laura Gorville, Erin Carleo, Anthony Choi. Anyone on for public participation this evening? Tiana? Okay. Anyone else on for public participation? I know we have a few folks joining us for appeals, but anyone other than Tiana on for public? Okay. Let's see. You know, do we want to maybe just go ahead and approve the minutes from last week and then we'll have public participation? Anybody have anything to add or share about the minutes?
There goes my thing again.
Yeah, that happens to me at work. I had one comment on minutes. Under the health director's report, third paragraph, we're just missing a consonant. PHE grant is in the last year. The has covered a lot of our training. Is it they or it?
Say that one more time.
So the sentence is, so it's under health director's report, not Liz Parsons, not budget, but next line, PHE grant is in the last year. Then it says the has covered a lot of our training. So I don't know if we want. it.
Oh, I think I meant it or the grant probably.
Yeah.
Yeah. Okay.
All right.
Just wanting to, prove my value as an elected official. Find a little word.
She reads them.
Yeah, well done. Anybody else? I'd take a motion to approve.
I'll make a motion to approve the minutes with the most recent adjustment.
I'll second that.
All in favor?
Orville, I.
Silver eye.
Linehan, aye. So moved. All right, Tiana, why don't you go ahead?
Hi, Tiana, 28 West Water, if that matters. I just want to say hi and put names to faces. I'm hoping to be on your agenda next month, but I'm a member of the Environmental Sustainability Committee and passionate about recycling and waste reduction, and hoping that some of the structures that the Health Department and the Board of Health have in place might be able to help us make. Apologies for the sirens from my 4.5-year-old behind me. I don't know if you can hear the sound. But hoping that I can enlist some of y'all's help in making some improvements to how we take care of recycling and
There's a fireplace, a fire.
can you hold that thought for just one moment, buddy?
And a fire pumper. There's a fire ladder, a fire.
Thank you, love. I'll be with you in just a minute. So I just wanted to say hi, and I look forward to talking with you all next month about it, and we'll make sure to get some ideas about what we could do on your agenda. So just want to say hello.
Thank you for reaching out. I'm looking forward to talking more next month too. I think it's important, and it's always nice to be able to kind of do stuff outside of COVID. So it'd be great to work together on that.
Absolutely. So thank you. I'm going to hop in and go play fire trucks, but just wanted to say hello. Fire mighty pups. Say hello to all of you. Look forward to talking with you next month.
All right, stay safe over there.
Bye.
Bye.
That was joyful.
Yes. All right. Is she on our agenda for next month? Did that happen? Cool. All right. Okay. And then should we go right in order? Any move right on to town news and carousel?
Well, we have a fee schedule is in order.
I believe that town news was first on the most recent agenda.
Oh, I'm so sorry. I didn't think that
Okay.
way. Okay.
I think maybe we'll just go in order.
Yep.
Anthony,
I think Maureen's able to join us. Maureen, can you hear us?
she's here. Yep,
Yes.
I see her.
Yep,
Okay,
I am
yes.
here. Thank you.
Yeah, so we can have Maureen kind of start because we're starting with town news and carousel variety. So do we want to start with town news, Maureen?
Sure, absolutely. Let me find that paper. So on Sunday, March 5th, I did a round of compliance checks in Wakefield with an 18-year-old male trained youth buyer. And at 2:33 p.m., he entered Town News at 231 North Avenue and was able, one, to enter the store, even though it's an adult-only store, and was able to purchase 2 Crave disposable vapes.
This is yeah, so this is Maureen was here to give some context as to the compliance check. Obviously underage sale to minor. So we wanted to make sure that we brought this to the board's attention, and it sounds like we have someone from Town News. Is that Mabuba?
No,
Yeah.
Oh, Mabuba. Okay. So it looks like someone's joining us from Town News, and just wanted to give them a chance because they asked to appeal the suspension and fine.
Can you review, Maureen, the regs that go with the consequence of the fine and the determination that is on the ticket?
Yes, so it's a cease and desist order that was mailed out, signed by Anthony and mailed out and delivered certified mail. And it's $1,000 fine for a first sale to minor violation. And I think Wakefield adopted a 3-day suspension.
Correct.
I mean, okay.
It's attached in the packet, Laurel, to a copy of it.
Okay.
So, sir, could you introduce yourself and maybe, I believe you're on mute, sir?
Okay,
Ma'am.
okay, can you hear me now?
So
Can you hear-
hold on 1 second. So sorry, Mahuba, you'll be next. Mahuba's Carousel Variety.
Right now.
Anad is from Town News, so he,
Anad.
Okay, got it.
thank you.
Can you guys hear me now?
Yes,
Yes.
sir.
Okay, so my name is Anand Patel and I'm the owner of Town News. I've been operating since 2005. I've been in business for 18 years, and this is my first violation that I made a mistake. And do you guys have any video or picture or anything that I've sold it to? If I made a mistake, I admit it, It's never intentional, and I take extremely proud of my business that I've been clean for 18 years and I do everything legally. I don't do any kind of shady business here. And I work 12 hours a day, and I used to have a help from my dad, and he's got a back surgery, and ever since that I'm working alone. I'm doing everything I can. I'm just requesting if you guys can give me a break on not shutting me down for 3 days. Even if I have to pay more fine, I'm okay with it. I'm just requesting, if you can do that, I really appreciate it.
Okay, thank you. Is this the first violation on file with the health department in 18
Yes.
years?
It's in 18 years, yes.
Maureen, could you confirm that?
I don't know about 18 years, but I can go back 10 years. And it's the first sale to a minor violation. There have been other violations along the way. In fact, I didn't do this calculation because we haven't fined the store for this. But on many times when I've done a compliance check, the youth was allowed to enter the store and go up to the counter. And that also happened in this case. And I've talked with folks at Town News many, many times. And we've talked about putting a buzzer on the door or whatever to make sure that a youth can't pass the threshold, because it's actually a violation if an underage person crosses the threshold and approaches the counter. And in this case, obviously he was able to, we approached the counter and also made the purchase.
Right.
So
Right,
So we're talking about actually two issues here, right? The entry to the store and then after that, the purchase.
correct.
so,
This could have been
so,
2 violations, not 1.
Okay, but this fine is actually just for the sale, is that correct?
We only cited the store for the sale. We didn't cite the store for the allowing a youth to enter the store.
Mhm. Okay, thank you for that.
Mhm.
so I also have a lottery business here, and Mark's Smoke Shop, he doesn't lock his door. Neither does he have buzzer on it. And when there was pandemic, Mark was allowed to be open for 1 month, and I was shut down by Maureen for 1 month. So that's the thing that I don't understand. How does that work out? Is something going on against me? I haven't done anything wrong in 18 years. I'm doing the best I can, and I did make a mistake. I admit it. I'm not fighting it. I'm just saying, at least give me a chance to do better. I don't mind, but if you shut me down for 3 days, that's gonna hurt 2 families, because I have 2 daughters that I'm taking care of, and I have my handicapped father that I'm taking care of, all out of one store.
We understand the circumstance that you're talking about, and I think our goal is not to be punitive, but I think at the same time, I think because this has been an issue in the past, and I'm not going to speak to another establishment right now. I think this is specifically about this establishment. I think because there was a sale to minor, and because there has been other instances of youth being able to enter the store, even if a sale wasn't made before, I think the problem is now we've seen a pattern of multiple times the enforcement not being put into place for the youth to go in. So
Yeah, I'm sorry to cut you off, but can Maureen confirm that? When was this? What date? What time? I don't seem to recall that.
I believe she confirmed it at the beginning of her report.
correct.
Well, she said 10 years ago. Does she have any date, any time? Anything
So
on it?
tonight, actually, we're talking about the violation that took place on Sunday, March 5th at
Yes.
2:33 p.m. when there was a sale to a minor.
Yes, that I understand. Yes, that I
And then
understand.
you suggested that you've had no other violations. I didn't prepare a report of other violations, for which, by the way, we have not fined you in the past. I come to the store afterwards and I say, by the way, remember, you can't let a youth come into the store. We've had that conversation several times. And
Yes,
because,
which I did not.
excuse me,
Which I
if
did
you-
not.
if you
Pardon
could
me,
just let
sir.
me-
Sir, I will let you finish first.
Yeah. Please go
Okay.
ahead, Maureen.
So because we didn't fine you, I didn't put that report in our data collection system, because if I had, I would have to fine. So I gave you a verbal warning each time that happened.
Tonight the board is going to be Tonight the board is deciding on this past sale to a minor. It is not. It's not about the historical.
Okay, so I'm just requesting if you could give me, at least give me a chance to improve and not shut me down for 3 days. I don't mind the fine, but if you shut me down 3 days, it's really gonna hurt my business. I mean, it's already hard as it is.
Laurel or Elaine, any thoughts?
Is there signage on his door? Didn't we have that at one time, Maureen, for the adult
Yes.
stores? And
Yes.
was there signage on his door that it was an
Yes.
adult? Okay,
So I would just suggest that we don't make a determination until the end of our meeting. I don't want to make I would rather hear the next appeal, so that we're looking at these in whole rather than setting a precedent on one decision and then the next. So that's my only thought right now. I have no further questions.
Wayne, how do you feel about that?
yeah, I think I can't recall right now what the next violation was, but let's
It's,
hear that. and then maybe-
Carousel, I believe, is the next one,
Yeah.
or a similar sale to a minor. if I'm not
That was a
mistaken.
similar sale to a minor, but Carousel is not an adult-only store, am I correct?
Yeah,
Yep.
it's a convenience store.
It's a regular convenience.
Right.
store.
Yeah.
And if my understanding is correct, I believe the history is not the same as it is with Town News. The history of interacting with the
I
health
would,
department.
I would probably let Maureen go through the actual run through of the violation first before we go into the history.
Okay, why don't we go ahead and
Okay.
hear from them?
Sure. Again, on Sunday, March 5th, when I was doing a round of tobacco compliance checks in Wakefield, an 18-year-old male trained youth buyer entered Carousel Variety at 436A Water Street at 1:49 p.m. and purchased 2 Crave disposable vapes. He was not asked for his ID and he was not asked his age. And I could add, Carousel Variety has fairly new ownership, so there really isn't any history. I've inspected them and done a new retailer education, but I believe this is the first round of compliance checks since this store owner has been there.
Yeah. Yeah, we are really new ownership, and I mean, we are like, I talked with the employee. They didn't check the ID because he has some family issues. So he was like totally out of mind, and he asked me for leave, but I couldn't go to the store. That's why he had to go. So he was like kind of it was like shift changing time. So the guy came and he was like so quickly try to give him and get out of the store. So that's what happened. So I'm just requesting that just give us one chance. I believe it's not going to happen in the future. So because we are really new and we are learning so many stuff. So please give us a chance. And please do not cut for 3 days at least. So it will hurt us. That's all. Mhm.
Elaine, Laurel, any comments for Mabuba? Specifically?
No, I have no further comments.
Okay. Feelings in general about these appeals?
I would just say, again, not to discount anything that's been said tonight. I think it's important for us to hear from the people that are behind the permits, right? Everybody who works in town, are valued people of our community. I think one of the important things for us to consider is, and this is the board's decision, not ours, but I think it's important for us to know that we're setting a precedent when any decision we make here tonight, right? So I think we want to make sure that we provide adequate retailer education, which Maureen does lots of when she is out. Every opportunity she has to educate rather than fine is done. I know her philosophy is rather than to, because we know there's a lot of turnover. We know there's a lot, it's difficult to find employees right now, but I think Maureen's done a great job of educating all these store owners and, giving everybody a fair shot at it. So I just want to make sure that, we don't set a precedent here tonight where we're gonna have to hear every time there is an appeal. We want to make sure that we're treating everyone fairly.
Mabuba, when did you
Yeah.
receive your training, your new business training?
I mean, the same day, I think the day we took over, it's September.
Okay,
We took over on August. So I believe it's in end of the August or September first week in between this time.
okay,
Yeah.
and then this infraction happened in March, like,
It's happened in March.
Okay.
Yeah.
and Mr., forgive me, your last name again, sir? Mr.
Anand.
Patel?
Yeah, Mr. Patel. Yeah.
Mr. Patel, when did you receive your training?
I received my training in 2005, long time ago.
Okay. Thank you.
However, Maureen has done. Maureen, when's the last time?
So I'm required to do an inspection of every single store at least once per year. And every time I do a store inspection, I remind the retailer of the regulations, including the age requirement and more recently, the newer requirements that everyone's ID has to be checked, not just those who look under a certain age, which is the way we used to do it in the past. But I've paid special attention to reminding store owners that they have to check every tobacco purchaser, not just people who look young.
It's probably more accurate to say that the training has been performed within the last year.
Yes,
Since the last inspection.
absolutely.
Mr. Patel, do you have any more information about the person who made the sale in your store to the minor?
Yes, I was behind the counter. I work all 7 days. I got no help, and I've been extremely overworked. But yes, I was the one behind the counter. Yes.
You made the sale. Okay,
Yes.
thank you.
So
Yeah.
in both of these appeals, there is admission of fault. It's, it's once again, looking at our regs, which we wrote stringently for exactly the reason of making sure that we keep things as tight as possible. So we're really being challenged on the reg itself, right? And so just remembering and we've all been reviewing these regs and reviewing the regs. We're going to review them one more time. They work. Our numbers are pretty tight with Maureen's incredibly difficult and arduous work to roll that big old boulder uphill. So I would not recommend any change in the ticketing at this point.
I think you're right. You have carousel variety, with a cease and desist, but that would be just for their tobacco sales. Am I not correct, Maureen?
Correct.
The old way where everything is removed, but they still are able to operate and sell whatever they have their lottery. And at Town News, do I believe you also sell lottery tickets, newspapers, and other
That's right.
things? So all you are going to be ceased and desist is on your tobacco, and your tobacco products have to be removed, and it's only a 3-day hold on just the tobacco. Am I correct?
Correct.
Right.
And we have allowed in the past up to, within a 30-day time that the establishment could choose which 3 days in a row. So that's where we have some wiggle room here, is kind of look at your 3 least busy days, or and do it on those days. But when the establishment determines what 3 days, we generally do an inspection, Maureen, to make sure everything's locked up.
That's correct. That's correct.
Okay. We haven't done this for a long time.
Yeah.
So thank you
So
for clarifying my memory.
So I had a couple of questions regarding that, because I've never been through this. So I know my days that I want to shut down. It's gonna be Sunday, Monday, and Tuesday. Now, if I close the store completely, that would be okay. And so what you are saying, if I keep it open, I have to remove all my tobacco products, right?
Correct.
And then do the other business. So if I keep it closed those 3 days, I can do that, right?
Correct. That's
Okay.
it.
Okay, so that's what I'll do. Can I close this coming up Sunday, Monday, and Tuesday?
Yes.
That does not require a vote, so Anthony is speaking on that behalf.
Okay. So I will do that, and
Okay, hold on.
Yeah.
Sorry, Candace. Mr. Patel, are you finished speaking?
yes, I am. Yes, yeah.
Okay.
Okay, so sounds like a plan, and that's, that has worked in the past, and the reg maintains its strength.
Also, should we also confirm the dates of carousel varieties, 3 days?
Yeah, give me 1 sec.
If he wants to look and call the office tomorrow, I think that would be permissible as well.
So it is not possible to like hold this suspension for 3 days.
I don't believe so. That motion is not the table. Would know when it's made the motion to suspend the violation.
Okay, and we have to pay the fee too, or? Okay. Email. কোন 3 দিন বন্ধ রাখবা সেটা বলো, কোন 3 দিন স্লো হবে না কিছু না। কোন 3 দিন তাড়াতাড়ি বলো, আমাকে বলতে হবে এখনই।
Should we give her the opportunity?
Mahuba,
Uh,
Mahuba, if you wanna
Yeah.
think about the 3-day time frame and call me
Yeah.
tomorrow in the office, you can do that.
Okay, okay, yeah, that's fine then.
It should just be within the next 30 days, right?
Okay, yeah.
Mhm.
So look at your calendar and see what makes sense.
So it have to be continuous 3 days, or it can be like
It has to be 3 days in a
Wait.
row.
2 in a row. Okay.
Yep.
Okay.
And you understand it's just to not sell tobacco. You don't have to close your store.
Yeah, yeah, got
Okay.
it. And we need to take those out, or we can keep those.
You have to take
in a
it off
place.
the shelves.
Take it off. Okay, from the shop. Okay, got it.
Okay.
Okay.
Thank both of you, Mr. Ferdosi and Ms. Ferdosi and Mr. Patel for joining us. I appreciate you.
Thank you very much, everybody. I really appreciate it.
Thank you.
Thank you.
Thank you.
Thank you. Take care, guys.
Okay, and
Good night.
Are we all set here?
all
We're
set.
all set with
All
you.
set.
Bye, thank you, Anand.
Thank you. Yeah, thank you, guys.
Okay.
Okay.
Thank you
All right.
Maureen, again for your incredible work.
Oh, you're kind.
Well, we always, make it. Oh, well. Integrity was the word I was looking for. The integrity
Yeah,
of
I-
regulation. It's like, okay, if we just.
right. And I appreciate that Laurel, because once you
Right.
move away from that, then everything is questioned and everything begins to fall apart. It's a slippery slope.
Right.
It's hard. It's very hard when people come in and they all have their situations, and I
Mhm.
appreciate that, but you're absolutely correct. It's important to hold up to the regs.
I agree. And I think this is one of the more serious regs that there is. So I think that we need to stand behind it and we need to be strong. So I'm glad everybody seems to agree.
That's why I didn't want to vote on them separately, because if we had made any change, it would have been, oh,
Yeah.
no, we're already starting down there. But the other shop, believe me, the other shops had their time.
Sure. Sure. Okay. All right. Any other thoughts about that? And then maybe we could move on to the fee schedule. If not,
Well, Maureen, do you want to do, we kind of added the town news and carousel on top to do that first. And then I didn't realize it was on top of the fee schedule. We should have flipped it and have, since we have Maureen want to talk about
Okay.
tobacco or whatever you think, the fee schedule will be quick.
Yeah, Cindy read my mind. If we want to do tobacco first, because Maureen's here.
let's do
then we
it.
can-
Yeah, that makes sense. Yep. We're talking tobacco. Let's keep talking tobacco.
All right, that sounds good. Yeah, so just wanted to make sure that we are all on the same page. I will say Cindy, Aaron, and Maureen put a lot of time into digging through the old minutes to make sure that all of our regs are cleaned up and ready to go. Make sure we have a final copy of all the regulations that you guys worked so hard to vote in before. So we want to make sure those are all correct. We have confirmed, we're confirming with you guys that there is a retiring cap language in the regs right now. I think that was one of the questions we had. We also have, I think were you guys sent the packet with the information as well?
So I didn't open up the very last thing, as I was at work. But the packet that we do have is great, is kind of the attrition list over the past few years.
Right.
That I really appreciate, and I think we should look at that annually. But how are we, did we figure out how the language went missing and how are we gonna fix it? And where are we gonna put it back?
Well, so I think
What is the investigative reporting here and who went blind? I appreciate you all.
I'm gonna speak out of turn here a little bit and say, even though this was before my time, I think there was a little bit of record keeping in both print form and on a computer. I think Ruth made a lot of notes in a couple of different places, and so all well intentioned. I think everything was
Oh, let's
kept.
explain COVID, but anyways. Keep going.
Yep, I think everything is there in some form. It just needs to be put in one place. So I think we finally managed to capture all that together.
Okay.
Yep. And moving forward, I think we have one place to store it now. Cindy has designated that one place that we're keeping all of our changes. So any amendments we make in the future, we'll just refer to that one document, so we'll know.
I suppose as a matter of, if you get more hands on a document that you have to go to Google Docs, and which would, I believe, track every adjustment and date it.
Correct.
And then clean it up. So
Yes.
I'm really sorry. It's back to back with patients. Do we have the final, what is supposed to be the real reg, or do we have to review it, comb through it and say, yeah, this is the reg that we believe follows what we think?
I
And
believe
Maureen, is there any state change in the meanwhile? Because I don't want to look at this reg again in the next.
Nothing for me until we have something really big,
Or
Laurel.
see anything at all. 'Cause
well, okay, so I do have to interject here a little bit. So we do have one change that we would like to present to the board tonight.
Oh, that's right.
Yes, so currently there is language in there so there's no transfer of permits, between establishments. They are locked by location. So we were going to have a discussion on, should we have that transfer of permit still available as not transfer of permit, but a permit being sold to another establishment that comes in looking to sell tobacco afterwards? Should we allow that to keep happening? I think for us, I think we do so much work, and Laurel, you're part of Wake Up, so you're directly involved in that. I think a lot of the work we do around prevention, there's primary prevention. We want to work with the community directly, but we also have a policy level tool here. And I think because of all the negative side effects we know tobacco presents. And vaping is just the latest issue we've been faced with. I think it's within our power and policy to kind of look at ways to kind of look to decrease our permits within Wakefield. Part of Maureen's program, the goal is to get to zero tobacco eventually, and I think it's a lofty goal. We have to chip away at one at a time, and I think from a principal standpoint, I think it's
I agree.
we have tobacco permits, right? We have tobacco permits.
That would like to put ourselves out of business. It just never happens.
Yep. We have tobacco permits that we issue, and at the end of the day, those permits are from the town. And I think we want to make sure that we're doing everything we can to decrease our exposure, especially to youth. As much education, all the great work that Maureen does, to help prevent those sales. I think we still see that this is still going to happen. So I think that's just one factor in all of this, right? But if we have a chance to decrease our permit holders in Wakefield over time, I think I would like to propose, if possible, that we look at that language and say, once a change in ownership happens, that permit is not going to be able to be picked up by another establishment at that same location.
Retired. Yeah.
Yeah.
So
Retired permanently.
sounds like we need new language. And then we're gonna have to look at this one more time in its entirety. Elaine, I was just trying to remember the history on how we got there. And to my recollection,
Well, the thing was to definitely decrease the number of permits, okay? And probably to get to zero, okay? But we had established it that if a variety store or something sold, and the place coming in that bought that business was another place that was going to be selling tobacco, such as another variety store, that we would keep that permit to that location. But if it was another establishment, as we had had at that time, was a variety store that sold to a, like, I don't know, some kind of clothing place, that permit was gone whatsoever. It was decreased and never to go back again and never to be given to anybody else in the town. My thing with it is that when there's a new establishment coming in and it's replacing what was there, are we prohibiting a business to come into town? Are we taking away the local variety store, which people go in to buy I know they can buy cigarettes, but tobacco sales aren't really that high as we think, okay? You know, your lottery, your milk, your bread, your newspaper, things like that. So would we be taking away something that it's part of the community? Sometimes your little local stores are part of your community gatherings. Those who don't have transportation, you know, don't have a big public transportation or something like that, use your local variety stores. I do. I love to walk to them and get my milk, my bread, my candy too. I do go get a candy bar once in a while. No lottery. I'm not a lottery person and I'm not a tobacco, but I'd love to have a piece of candy when I'm out walking for a mile. I mean, that's the way I feel. I think that we did that purposely so that we wouldn't be prohibiting a business. But if we keep it the way we are, will we ever get to zero? I don't know.
Maureen,
Yeah.
is there a precedent in the other communities
Yeah.
you work with?
So here, the issue, and thank you, Elaine, for bringing up that history, because you're right.
Really well.
There was a huge discussion around if a different kind of business came in and was in that location for a year. There was even a time, I couldn't find it, but there was even a time on it, then that location could no longer have a tobacco permit if, you know,
Right.
if the second store went out and it was suddenly available for some other kind of store, couldn't have a tobacco permit. So that is true. The other discussion that we've had at the state level, and the reason that the initial tobacco permit language was drafted the way it was partly as a protection for the building owner or the location owner. So a lot of variety stores are leased.
Yeah.
So somebody pays rent. If that person leaves, retires, moves to Florida, whatever it is, and the retail space becomes vacant, it was thought that it was more valuable to that space was more valuable to the building owner if the new leasee coming in could have a lottery permit, could have a tobacco permit, could have all the things that typically a variety store has to have in order to be, you know, a successful business. So that was the thinking back when when we first started rolling out permit caps in our local communities. If you did consider that, changing that and saying, once a store folds, leaves, closes, whatever, no one can ever have a tobacco permit in that building, I think that would be enough of a change that you'd probably want to have a public hearing.
Yeah.
Because I think it could change the value of the building. Especially if you think about like a gas station. So if you have a gas station mini mart, you know, Cumberland Farms up on the lake, that would,
Oh, yeah.
yeah.
I see what you're saying. A gas station, you know, a different company takes on the gas station. It's just assumed that that's the whole piece, you know.
No gas company is
that-
going to go in
that-
there, have a
yeah.
gas station with no
Right.
tobacco.
And we are, you know, we do thread the needle between, you know, the desired outcome and a realistic expectation and, you know, allowing people to put up with our, you know, substance use prevention talk without cutting them up at the knees. Is, you know, like adults will be adults, you know, stick with the kids. You know, I could just imagine, I'm just pre-thinking what, you know,
Yeah, yeah.
because I imagine if we we put out to a public hearing, I think it would be due diligence to make sure that the current stakeholders, including everybody with a current permit, be allowed to speak. And I'm fairly, you know, I think it's fairly predictable that I do believe it's legal, but I do believe we might get a little heat from Cumberland Farm legal, you know, people who have deeper pockets. So in theory, it's a neat idea, but in practice, if you think, especially with that example of kind of a corporate footprint, you know, we could be getting ourselves into a
You know,
value
let me do this. We actually had a discussion at our statewide meeting about density and how important it is to reduce density. And so it was really an introductory, something that the state is going to work coming year. How do we reduce density? We've done this. It just goes so far and it moves very slowly. Like Elaine said, we'll never get to zero if, you know, if we do it this way, or unlikely. So I think the state is going to be looking at more ways to tackle this density issue. But let me ask my colleagues if anybody has done the kind of permit app where once somebody gives up the permit, it becomes permanently unavailable at that location. And maybe somebody has, and I could just not have, not know about it, but I can ask colleagues if anybody else has done this, because I'm torn between, the community interest, whether it's having a variety store in your neighborhood. And Elaine, we're losing a little variety store in my neighborhood that is right near senior housing. So multi-story senior housing, the town would like to see a liquor store there, but
Yeah.
this is where people who can't drive go to get their bread and milk and so on. And I think that variety store is going away. So I'm torn between having the availability of those kinds of stores but yet knowing it's really tough for these businesses these days, because some people go into variety store, but not in the numbers that they used to. In certain age groups, they don't even know what a variety store looks like anymore. They order everything online, or they go to the bigger stores like a Target that now has milk and bread and clothing and furniture and lamps, whatever. So I have that on one side. And then of course, the other side, my tobacco prevention side, is we should do everything we can to get rid of every point of access, selling online, crossing the state line, obviously stores that sell and are right in the kids' faces. Carousel Variety is on Water Street, but it's right at the end of Farm Street, where kids come out of that high school, and even the other wood, I forget what store.
Yeah.
Yeah.
That's what the fifth graders are.
They
Fourth
come out of,
graders.
they come out of they're right there in front of Carousel Variety.
Erin, why don't you go ahead?
Oh, I was gonna say that I thought we had the language also that like a new owner can apply for the permit, like give it a time limit. So it has to be within 30 or 60 days.
Or I was even thinking like a year, like apply for the permit, like, has it ever been discussed? Like, all right, get in there, run your business, apply for your permit. You can, if everything
But
goes
it has to be at
well,
the same location.
yeah, you could sell tobacco after a year in business.
Oh, that's not the way we wrote it.
No, I'm just, if we're talking about making a change, I understand that it's not the way it's written now, but.
I think that's
We
a good
said
idea.
60 days.
Yeah,
I
we
think
did.
that's a good
I
idea.
don't see the 60 days though, Cindy, in the
I
regs.
know, but we did. I know.
No, I don't know
was.
where it went. Yeah.
Okay,
I
so
think
could-
that was done. I think that was done because I don't know how many people know, but it's not easy to get a tobacco permit from the state. I mean, you probably know. I've had people who used to come and they have to file all these papers and get their tax numbers, and most
Oh,
people.
in the with the Department of Revenue?
Yeah, and sometimes it takes a long time. So a lot of people who know that, like Bob Smith's gonna sell his, everybody knows who's gonna sell what before anybody else really knows sometimes. Or they have a friend that they want to buy their convenience store. So they'll go and start all that paperwork. So
Right.
when they come to do the actual sale, they'll be saying to the town or the city, you know what, we're going to purchase this. It's going to be a change in ownership. And we already have our tobacco permit. We have all our paperwork done. We have our lottery stuff done. They do all the stuff behind the scenes before they really come out. Because I
It's true.
found that in the last, like, I don't know, Maureen, maybe you have, in the last like 10, 15 years, I know there aren't many more corner convenience stores, but those that are there always have somebody lined up to buy their business. There's always a customer, a relative, or someone who comes in. As soon as they know that they're selling it, bingo, they grab it.
Store never really closes. Somebody,
No.
counter one day and somebody else the next. You're right.
Yep. They change overnight. Sometimes you don't even know. You have
Literally.
no clip. And
Yeah.
Maureen, is there any more word or work being done? I know that at one time when we were writing these regs, that they were looking into, remember how many feet, wasn't it 500 feet from a school?
Some, yeah, so Wakefield has, oh, no, Wakefield doesn't have a proximity ban, or I don't think they do.
Because they had a retiring cap. and it was
Right,
moot to
right,
have it, yeah, okay.
So communities that don't have a retiring cap often have that language that no new stores within 500 feet of a school. Reading's happens to be 1,000 feet of a school, no new stores within 1,000 feet of a school. But that is language that many communities adopted, and they call it the proximity ban.
Oh, man, we gotta look at the whole, we gotta.
Well,
look at
so
the
do you
guidelines.
guys remember that we talked about the proximity
Yeah.
ban in one meeting, and then I think 4 months later, we said we can
I
take
know.
that off because now we have the permit cap, or we did 2 tobacco meetings within 4 months of each
I
other.
know.
Yeah, so my suggestion was to just add one sentence for right now that somehow got removed. But there was a sentence that just said, like, so it's, you add it under section F to the permit cap, you would get rid of the proximity ban language because we don't have it there anymore. And it just says no location that does not have a tobacco product sales permit at the time of the public hearing, which was 10/17/18, will be issued a tobacco product sales permit. And somehow like that got removed, but if we just put that back in, then it's clear that like we're not allowing new permit holders at new locations.
Got it.
Yeah, so I think it can just be as simple as that for right now.
Yeah, that's why it was written that way, because we didn't want anybody, and then that protected us that if it was a convenience store and they sold it to maybe a toy store, and the toy store only lasted maybe 6 months, and then it went back to a convenience store, that didn't mean that they could go back to that permit. It was done. Once it's
Exactly.
done,
But that's a language that went missing that we need to put back, and
Yes.
we need more than what Erin just said. We need that, we need to make a decision, right? So on the table, we have Anthony saying, guys, we're public health. Like, we retire it the moment it closes, as opposed to kind of what we know to be true about the retail business and all in this expectation and prep work of buying someone's variety store, and it remains the same variety store, and that therefore there's an expectation that that license, that the permit from the town would be granted. And then we put the brakes, the stopgap in there with, if there's an interruption, if you didn't do all that due diligence with revenue and state work, then that's our break opportunity. But we need to be clearly super clear, because we lost the language. Maybe it wasn't the best language to begin with now. So I would suggest that we really look at we have to look at it line by line, and I apologize, I'll pull it out, but I really think we need to be clear on, this is our final draft, and this is the language, and maybe what we need to do is put, in section F, this is the proposal, and then we hammer that out next meeting. With those 3 options, right? Option A, permit gets retired the minute the store, the minute the permit is expired and not being renewed. Option B, a 60-day opportunity for transfer. It's not we can't use the word transfer, but we need to find the right word.
Yeah, I think the wording is essentially allowing for some level of backdoor communication of sale, right? I think that's, we are trying to prevent transfer, but this is more of a kind of handshake deal.
Yeah, but
I think that's where we're gonna get tripped
the
up.
word
I think
handshake, I'm not putting the word handshake in a.
well, that's what I'm
Right,
saying.
right?
I think the reality is more of a handshake deal. So I want to be careful that we're not
Right.
put in that position.
There's a
Yeah.
regulation east way to say this. And so maybe, you know, as a working committee. I
So
don't know.
I think the language, and I don't have it in front of me, but the early state language was something like applied for within 60 days or something. So it doesn't say transfer because we can't do
Right,
that.
right.
So if the new store owner, a new store owner applies within 60 days, so the intent was, and some towns have 30 days, some have 60, but to allow a grace period for some, you know, someone to give up a store and someone else to open a new store,
Right.
whether they do it knowing each other and have that, you know, behind the scenes thing, which we don't care, we don't necessarily know about it, or whether a store literally closes and somebody jumps in and says, oh, I can open a store here. Also, by the way, I did want to remind everybody that in addition to the building owner, in the event that the store owner doesn't own the building, the thought that the state also had when they were rolling this out was that sometimes a store owner works in a store for 40 years, 50 years or whatever, owns the store.
Right. And they need
retire-
equity, extra equity.
That's his retirement.
Yeah.
So that was, felt that there needed to be some protection for the value of the, so. Yeah, I think you're right, Laurel. Three
Yeah, options.
options, yeah.
So,
Okay, and what's the
so-
third option? What's the
What was
third?
Nothing,
That there's no transfer. That's it.
not the word transfer, but it's retired.
There's no, it's
grace
done.
period.
Yeah.
So the three options are retire permanently, or the second option is to keep what it is right now with, let's say, a 60-day or 30-day allowance of another store to come in that same location. What was the third option?
Oh, no, you confused me.
No, I think there's really
There's
only
two.
two options.
Yeah, I
There's
think it's
two
only
options.
two. Yeah,
Wait a minute.
because it's either it's totally gone or
think-
it's not. Or I mean, the other option is not to change
Well,
anything.
and then the other is, do we do this and a proximity
I
regulation?
don't.
That's
I
why
was
you
gonna say.
go
I think if it's a retiring and still locked into that location, I think we're.
That's
I think
right.
the right.
That's
Yeah,
right.
yeah. So the proximity may not be
proximity ban.
necessary.
It's
Yeah.
Right.
moot.
Yeah.
I mean, you can
So-
write it down, but it's kind of a moot person,
Yeah.
you know.
Yeah.
because
Yeah.
of-
Right,
So-
and we should keep things as simple and clear as possible.
Okay, so we have two options on the table. So this sounds like Maureen's suggesting that we have a public hearing about this. Should we have this next meeting then?
Yeah, but we were gonna have the other person who joined us earlier also at that meeting too.
The recycling.
Yeah.
I'm not sure if that will just mainly be a presentation by her or Anthony, and then, but I don't think the board would do any voting that night. It would more just be hearing the information, right?
Right.
We still have
okay.
our usual business even when there's a public hearing. So I think we'll have the public
Yeah.
hearing either before or after the usual business. Probably before.
Well, to be so, and just to review process, should we want to change the dumpster regs? So I think what happens is we talk to sustainability. We go, you're right. We might want to change these regs. We draft the changes. The draft is presented at a public meeting. So it's like
Right.
3 meetings. Believe me,
No, probably, I mean, we still have to dig up and review the regs we have and
Right.
then think about if we want to make changes and then,
how would we do that? So,
Right. okay. All right, well, she can present next
Yeah.
meeting then and we can have the hearing.
and I don't know.
We're gonna
Erin.
talk to her. Anthony and I are meeting with her next week.
Oh, good.
also,
Okay,
so just-
Cool.
That's great. Okay. Thanks, Maureen. Thank you, Cindy, for being a collective memory.
Good, now we have to walk down memory lane. Have a good night, everyone.
Thank you, Maureen.
Thanks.
Maureen.
Catherine, we had her for a minute.
Catherine's still here. I think her camera's off though.
Okay.
Hi, Maureen. There's Catherine. Hello.
All right, fee schedule change?
Looks good to me.
Okay.
It looks great.
I could go a couple more hours if you'd like, Laurel.
Wow,
No,
awesome.
You ate your
thanks.
Wheaties today?
I know fee schedule is everybody's favorite thing. So if everybody's good, I don't think we had any changes other than that from last time. So same draft as last time.
Okay. So does anyone want to make a motion to
I'll
accept-
make a motion to accept the changes in the fees as they have been presented.
Second that.
All in favor?
I,
Or-
Silva.
I, Gorville.
Linehan, so moved. Excellent.
Awesome.
Well done. And then Anthony, I think it's you, yeah? Health Director's report?
Yep, just gonna run through a couple of things. We have Melissa here as well. Sandy couldn't join us, but Sandy helped us draft the nurses report, so I wanted to run through that. You
Thank
guys
you for
received,
that. That was great.
you guys received that, right?
Yes, that was great.
Yeah, so just some highlights. We have 10 to 13 residents now coming to the weekly blood pressure clinics. So it's good to see some of those numbers pick up. Sandy and Melissa have been working very hard to market Heart Health Month in February. It was good to have blood pressure available to employees. We had 13 employees attend. We talked about blood pressure screening, benefits of dark chocolate and fruit for heart health. We posted.
Lots of dark chocolate. It's got a new ding on it. Then it was sorry. Go.
We also had heart health signs posted at senior center, city hall, and health department. We really want to help kind of raise awareness around different issues, and so having like we said during town council meeting, having the extra capacity has been really helpful to have Sandy work on this as well. We are currently preparing colon and rectal cancer information. I know Sandy and Catherine and Melissa have been working together to bring this information forth, and so we're hoping to do some more posting, get some more information out in the community. They're also planning ahead of time melanoma and skin cancer awareness for May for a posting of information then. And we're in the process right now reviewing the 2022 vaccination season. So we're going over a lot of our clinics, seeing what worked, what didn't. We're going to be ordering vaccine as late as next week, I think. Shouldn't be waiting any longer than that.
Wow.
And
we're going to be determining what we need for next year.
we're still
Yeah.
vaccinating in my office right now. We're still offering like this
Wow.
flu vaccine.
Oh, okay. Well,
No,
it's
it was an
late in the
amazing-
season.
It was amazing. We thought we were gonna have a triple threat, and all of the articles I'm getting is like somehow we escaped. Somehow RSV and flu went right back down, and the
It's
COVID.
a norovirus that's around now.
It's not making the headlines, but yeah,
No.
it's everyone. But it's
Yeah, I feel like the kids, it's been
Are you speaking from experience? Is everything okay?
Oh, yes, yes.
she looks like
Yeah,
that
it's
lives
always
experience.
it's
How's
usually
the
the
kids?
week before February vacation, Erin. Every school nurse would call and go to me, I think it's here.
That was
We're
exactly
here.
it.
We're
It was
leaving."
Valentine's Day, and it
Yeah.
was a rough time.
Every
for us.
year. Awful.
Yeah.
Aw.
I like that the skincare is happening in May. I think that's perfect. I feel like we haven't had awareness campaigns about skin cancer. So I think
Do
that's
we,
great.
do we have a festival by the lake date yet?
June 11th, I think.
All right.
That would be a Sunday. That's not right.
June 10th.
Okay. Catherine, is there an alcohol awareness month? Because all of these diseases are impacted by alcohol.
It's April.
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 It is April. Yeah.
Right.
Well, actually, that's a good segue. So glad Catherine's here. She was able to work with Amy and get in the STOP grant application. You guys worked very hard on that. It took a lot of effort. I know it was between you. You're also going on vacation too, Catherine. So I don't know where you found the time to help write that, but yeah. So that grant is in. Very timely discussion on alcohol. We'll be sharing, maybe we'll have a presentation with the board as well at some point. There was a alcohol report for the state of Massachusetts that came out in December of last year. Numbers weren't very promising. We are leading the nation, but not in a good way in terms of alcohol use. And so, our good friend Liz Parsons has been consulting with us. She has great connections, obviously, from her work now as a national policy director on alcohol, and now working with EU as well to produce that report. And so one of the things we're working on is we're piloting an alcohol town hall event in Melrose on April 1st. We're basically inviting all of our policymakers that either work directly or indirectly with folks work directly or indirectly with alcohol policy and regulation changes. And so we want to kind of increase our education level with those folks. And so we're piloting that program, and hopefully, we'll discuss more about how we can, work on the regulations in Wakefield as well. I know some work in the past was done. I know the coalition's been very involved with that. And I think this is a good opportunity for us to pick that up again. So next time at the next Wake Up meeting, which is Tuesday, Catherine, is that right? Yep, Tuesday, I believe 9 o'clock in the morning. Our next 7-minute clinic will be on alcohol. We'll do kind of like a quick overview of numbers, but we'll also talk about kind of next steps moving forward of how much, how we want to get involved with the alcohol regulations review in Wakefield.
Anything else?
Melissa, am I missing anything?
No, I don't think so.
So I just wanted to update you because I'm getting a hot off the trail message from Senator Lewis. So Melissa had called me, someone called Steve about the Adderall shortage. And interestingly enough, Sarah Zellberg from Senator Lewis's office got back and said, this is what I'm hearing. But also offered for me to give them some detailed things, because her response is not, the response essentially was that there is only a shortage in generic Adderall, or generic amphetamine salt, and not brand name Adderall. I can assure you there's also a shortage in brand name Adderall from what pharmacies are telling our patients. And then she said that Mass Health is allowing, because I argued that I had a patient whose insurance, Mass Health insurance, was only covering generic, and she actually flipped the Mass Health expectation. And I wonder, and Candace, you may, you see this as well, right? Because our Mass Health patients are in a private management, so they could be Aetna, they could be Tufts, and those formularies, even though a master formulation in Mass Health is something, these management companies that manage a Mass Health PPO, I think it's PPO, may have a different story. So I'm gonna chase this down and see.
Laurel,
You could always suggest that folks ask for a prior authorization, and in the prior authorization.
And they're refused.
Even if you're specific about, I'm asking for brand name because generic's not available, patient's been stable on Adderall for X years, months.
Yes.
Refusing on what? Is there a better alternative than?
They want more information. They just, they're just saying, so I tried to change someone to Vyvanse, it just said no. And then today was more information, because I'm like, listen, like, this is stupid. What can I do? So but a prior auth takes time as well.
Of course. Yeah, it does.
The patient needs their med today, and I mean, they get their rejections out within 24 hours. Pretty impressive. But so it's just an interesting, it's just an example of up-down regulation effects. So it's not a bad idea to go, as being a board member who has that concern, to go up to a legislature who may be on the HHS committee to say, okay, what's going on up there? Because that is where Mass Health regs get affected. That's how it happens. So who knows? But it's just like, yeah, no, I don't think the information I got is quite reflective of reality. And I will find out.
Laurel, after I got your email and that went to Senator Lewis's office, I actually started looking at the commercial plans, and I went into formularies. I don't think I managed to get every formulary for every different product, but I checked Harvard, Blue Cross, Tufts, and United, and none of them listed the brand name Adderall. It was all generic. There were different dosage levels, but in almost every case, it said limited availability. And that's all the information they gave you. And if you possibly could get some sort of prior authorization for a brand name at or copay or coinsurance.
Right. Yep. So it's an interesting, actually more concerning to the population is the shortage in rescue inhaler albuterol. So that may be the next, and that it's certainly not in our purview, but I think understanding emergency shortages is like, we have to maybe rethink some things. I mean, we could go so far as to say, yeah, we gotta double down on air pollution. but it's just an interesting aside where practice meets politics sometimes.
Anthony, anything else? Melissa?
I believe that's it.
I do.
What do you got?
I'd like to let you all know that Anthony has been invited to be a guest speaker at the 25th conference of the Mass Association of Public Health Nurses. And he will be speaking on Thursday, May 5th. And Anthony's subject will be on the importance of having a public health nurse.
All right.
He's writing your speech.
All right.
It's not written yet. But we're very, very
Congratulations.
proud. Yeah, we asked him and he stepped forward and took on the challenge. And it's the past, present, and future. The Rear Admiral from Public Health Nursing from the CDC will be sending us the video. Dr. Al Di Maria, retired, is speaking. We have a couple of senators and everything. And we are very, very happy that Anthony will be part of our 25th anniversary.
Elaine, do you need to be a member to Friday?
To go? No, you don't have to be a member to go. No.
So how would I look that up?
Go on the MAPHN website.
Okay.
He's the last speaker of the day. I told them that they saved the best for last.
We'll throw popcorn. All right.
I'll say, all jokes aside, besides the $100 bill that she slipped me earlier, I think obviously it's an honor to speak before all the great public health nurses, and obviously they do great work. So I'm going to make sure to do all my research and be ready for that day. So yeah,
Will
very
be.
honored to speak before you guys. Yeah.
And don't worry, I'm going to record it.
You're gonna do great.
Thank you.
Okay.
Any other exciting news? That's a good feel-good piece of news. Next meeting then?
Oh, yeah.
Oh, actually, before we go, Catherine, there was one more thing. We talked about it today. Amy had received a grant for, was it school violence prevention? Was it related to? I know we talked about it briefly. Just wanted to make sure we.
Oh, yeah.
Yeah.
So actually, it's good timing. Today was our white ribbon event.
Right.
Yeah.
And we had over 80 people there. It was wonderful. Students, elected officials. It was just a great event. So Amy also serves as the interim director for Wakefield Alliance Against Violence, and through the health department had written a grant to build a youth leadership program focused on violence prevention. So that'll tie in well with the Stop School Violence grant to get some youth leaders doing some violence prevention work.
That's great.
Yep, good timing.
I'm glad to hear the white ribbon event was so well attended. That's wonderful.
I wish I could have been there.
Still on couch patrol.
Yeah, it's 1 week. I'm doing great, aren't I?
Yeah. No, I'm gonna get over there.
All right, that's all I got for me. So anything
All right.
else?
Anybody else hiding any pieces of information?
My team, the Susan B. Anthony's, won
Yes.
the trivia
Congratulations. I saw
I heard that.
and the costume contest.
Your costumes were beautiful.
We should make our own team next year. That would be what I'm proposing.
Oh, I did want to add one kind of nice follow-up to the tobacco situation from earlier. The youth action team is actually going again to present certificates to every licensee that did pass compliance. So they proudly hang up their certificates of passing compliance, and it's something that the youth present them with. So just kind of ending on that happy note that we did have a lot that did pass.
That is good.
That's great. To actually like offer a reward instead of just punishment all the time. That's wonderful. Cool. April 19th, it's break week. If that is a hurdle for anyone, it's okay for me.
Okay for me too.
Doesn't make a difference.
Soon, Candace, soon it will mean something.
I mean, they're in school, but we're just not going anywhere.
Okay, I hear you. All right.
April 19th, cool. And then I guess we're gonna put out, we're gonna set up a hearing for those
Yeah,
establishments.
we'll have that posted early. We'll have that posted early in the paper and whatnot, in all the places we need to. Yeah.
Great. Okay. Thanks, everybody.
All right.
All right.
Thank you.
Thank you.
Thank
Make a
you.
motion. I'll make a
Oh.
motion to close the
There we go.
meeting.
Second.
Is there anyone who would like to second that motion?
Oh, I did second.
Oh, all right.
Well,
All in favor?
Silver, yes.
Gorville, aye.
Linehan, aye. All right.
Nice job, everybody.
Have a great
Good
night,
night
everyone.
now.
Good night.